some new vaccines that are always, controversy you can have a discussion about. I think communities have to decide that. Each country has to make a decision on those. But I think for the important vaccines, I think the first thing I would do is first educate the primary health providers, the nurses, the doctors, the other people that work with people in the clinics, in the outpatient hospitals, in the hospitals. And then I would also have them develop polished sites, bring in techie people to bring in more polished sites to make sure that there is some kind of alternative that looks just as polished, looks just as good, but it's based on good science for pro-vaccine. I don't have a complete answer, but I also think the third thing that's really, really, really important is to start a dialogue with the communities. Bring in the communities, have discussions about their concerns, their fears, their anxieties. Every country, as you can see, those lists are long of why people are in the anti-vax movement. It depends on the country you're from. And I think it's important to have dialogue and to have discussions with the populations, with the communities. Otherwise, you're not going to go anywhere.
Just to follow up that issue, which is very critical in public health, weak governments and weak organizations, international organizations, can expose people. And NGOs are one element of the solution.
Absolutely.
A good example is most of our problem on resistance to vaccination is mainly from Europe and North America.
Right.
In Africa, it's a question of delivery, even many parts of Asia. An example is measles epidemics today in South America, where it was eliminated, came from Europe. Mm-hmm. So the problem is in Europe.
Yes.
Of weak WHO, weak UNICEF, weak national governments, because they don't see measles as important. Mm-hmm. So I think that's where it is important to look at it from different angles and bring this up as a priority issue.
I'm a little bit with my colleague here and with you that I think that we're going to have to rely more on ourselves, the people in the countries, rather than outside support. Because sometimes outside support is not the appropriate support. It's often not the appropriate support. Being working in consultancy sometimes and working with WHO for a while, I saw a lot of things that were not very effective or useful that were carried over from richer countries, quote, standard thinking in countries that had a lot of wealth, and then taking to countries that didn't have the same resources or the same background, the same culture, the same situation. So yeah, I totally agree. I think sometimes we have to, it has to come, here in Kazakhstan, it has to come from Kazakhstan. I think we have to do something within the country to really make a difference. I think we have to, because really the problems we're facing now with the internet, with these websites, are all originated in Western Europe, the United States especially, in Canada, in Australia, in the rich countries, coming in and infiltrating us because it's on there, it's on the website. Everybody can access it. And if you don't have any other access for information, you don't hear anything from your healthcare provider, you don't hear anything else about vaccines, and then you read it on the internet, what are you going to believe? So yeah, I think it has to come from us, from the people in the country to say, look, enough is enough. And I think in India, your point taken, a lot of work that the reason why smallpox was successful, because of the people who worked in India on that problem.
Yeah. Yes, question over here.
Yeah, I think I've also observed that when it comes to challenges in healthcare or health problems, as who are trained health workers, we believe that the solution lies with us. But in many cases, the answers are outside the authority, the power, the control of trained health workers. We need to look beyond our remit and see opinion leaders and equip them. In many cases, we go with information, we want to sit them down and inform them I think there is an opportunity now to investigate and see who are the opinion leaders beyond the influence of the internet in the different regions. In some places, maybe they are political leaders. In other places, they are religious leaders, depending from country to country, region to region. And then we need to equip them in a way that those who are living closer to the people, they can communicate in a way that will resonate with the people in the grassroots. I think in that way we're going to have a little more success. Thank you.
I agree.
Yeah, I absolutely agree, and I think this is one of the places where medicine as science has become kind of its own problem. When we focus on training medics in the science of medicine and how human bodies work, we don't give enough time to thinking about how to get them to understand people who haven't had that training. It doesn't matter if you can build the perfect vaccine if you can't convince anyone to take the vaccine. So we absolutely have to be training science communicators and also trying to engage communities and have communities also engage health practitioners back and have everyone better understand each other to bridge this often huge gap between the trained medical professionals and their views of what is happening in human bodies in the natural world and the various views of communities. Because if we can't bridge the gap, it doesn't matter how good vaccines we can possibly build. We are now coming up on 8 o'clock, so we have taxed our speakers very heavily right now. I think, Niels, did you have... we had a final comment here?
Yeah. So I wondered about the reasons for anti-vaccination. I mean, for example, what do you think? Are there any social or economic reasons behind? For example, in the past, during Victorian England, there was a compulsory vaccination policy, but people were afraid of it because of the poor sanitary conditions, and but they were forced because they could even lose job if they were not vaccinated. But in current world, yes, in these developed countries, are there any such kind of economic or social problems that force people to do all these anti-vaccination actions?
Well, there are countries that have mandatory vaccination programs, but there are more and more exceptions, and there's a lot of people who just refuse to participate. There are mandatory. I think dialogue is much more effective in many ways. If you get the whole populations behind you, if you can get, as you were pointing out, some of the key leadership in countries to understand what's going on. So you're working with the people that you know, and you know how to relate to those people because that's your country, that's your people. I think it's a lot more effective to have that kind of support, because what eventually happens in Europe, in the United States, is that they change the laws. If there's enough resistance, they no longer make it mandatory. They drop the mandatory nature. So really, mandatory is not, you really need a dialogue, you need a kind of an open flow of information and relationships with people, transparency that really doesn't exist right now. And it's now very difficult because Pandora's box has been opened. Suddenly you have all the internet is filling the entire cosmos, and you have to deal with people who are convinced, because it looks very convincing. If you look at that website that I showed, it's very convincing. If I didn't know anything about vaccines, I would say, I'm not going to have my children vaccinated. And so it's, I don't know.
Yeah.
I'd just like to add something to this whole. Again, I want to say that we have to unpack which vaccines are being resisted.
Right.
Not all. For example, even in Byron's presentation, all the physicians said, we are giving our children polio.
That's
Why was polio administered by the physicians? Why not other vaccines?
Yeah.
For example, if you look at HPV, for example, with HPV in Africa, there were big issues with questions of fertility, so we need to understand which vaccines are being refused, and also which vaccines, I'm saying something not very popular, which vaccines are being peddled, because
yes. There's
which
still
vac-
economic
Yeah,
interest.
so which
Sure.
vaccines are being peddled on
Yes.
client populations, on certain kinds of populations, because this opens up very important, I mean, India had a program of forced sterilization, so we really are coming from this experience of what is being peddled to what kinds of populations, which groups of people, and also then, where is the resistance coming from? So people are not resisting polio. Why are they resisting HPV? Why are they resisting MMR? So probably we need to think more critically, even about vaccine resistance per se, because it's not vaccine hesitancy or vaccine resistance per se, but it is which vaccine, when, which population, and and also it's building up on this great disbelief of the global pharma industry.
Yes.
I mean, so
We
we
don't-
need to, it's not divested from this great disbelief, this great mistrust of the global pharma industry
Yeah.
and how pharma and national governments are in lines.
Yes.
So, I mean, so it's quite layered, and it comes with lots of prior knowledges that people have of things around them. So that's my kind of.
I personally think that communities should be part of the decision-making process on whether it should be mandatory vaccines or not. Right now, it's usually up there in some parliaments or some distance